All right, we're a few minutes past the hour, so let's get started. Good afternoon. My name is Jared Leff, and I'm a senior research program manager at CHERISH, based at Weill Cornell Medicine in New York City. As senior research program manager, I provide administrative and logistical management support to CHERISH. So what does that mean in non-HR terms? Well, I consider myself the glue person for the CHERISH Center and to make the trains run on time. My role here today is to support the webinar participants and connect you to our pilot grant and training core director, Dr. Brandon Aden. Dr. Aden is an assistant professor in medicine and population health sciences here at Weill Cornell. In clinical practice, he provides addiction treatment and primary medical care to patients with substance use disorder. He is also the program director for the addiction medicine training program here at New York Presbyterian and has led the CHERISH pilot grant program since its inception nearly a decade ago. Brandon, floor is yours.
Jared, thank you for the introduction. Welcome everyone to our Q&A for the pilot grants. So the plan for today, so we're going to do a little introduction to CHERISH as a center and then go a little bit over the pilot grants program, answer some questions as well, and just sort of orient you to the program and then answer your questions at the end. So at the beginning, I'm going to have two of our former pilot grantees who are with us here today just introduce themselves real quickly, and then I will get into the presentation about the center and the pilot grants program. So Maggie, if you want to just introduce yourself to everyone.
Oh, sure. Sounds good. Hi, everybody. I'm Maggie Lowenstein. I am now an assistant professor at Penn in general internal medicine. And at the time that I got my pilot grant, I was a fellow here at Penn in the National Clinician Scholars Program, which is a health services research fellowship. I'm an internist and addiction medicine physician and also health services researcher. And my work focuses on kind of implementation of treatment and harm reduction in both general medical and kind of non-traditional settings, like non-clinical settings. I think I'm supposed to tell you just briefly about my pilot grant, and then we can probably get into more details later. But my pilot grant was focused around both the use of public libraries as a space for kind of education around overdose prevention and substance use treatment, as well as kind of a space that people spend time who use drugs and where harm reduction interventions sometimes need to happen. And so did some work, both qualitative work, interviewing public librarians, and a survey looking at public libraries in Pennsylvania around stocking of Narcan and other kind of practices that might address some of those issues. And so maybe I will stop there and I'll pass it back.
Yeah, that's good. And then next we have Tyler. If you can introduce yourself as well.
Sure, Maggie set the bar high here, talking about all these different things related to our project. My name is Tyler Bartholomew. I'm an assistant professor in health services research and policy at the University of Miami School of Medicine. Thinking back to my time as a pilot grantee, I was a first-year PhD student, brand spanking new PhD student, 3 months into it when I thought, hey, maybe I should go for a CHERISH pilot grant. And very fortunate to receive the funding and be funded to do an economic evaluation of the first legal certain services program in Florida, the IDEA Exchange program, through both a healthcare perspective and a societal perspective, and also was able to do some work on fixed site implementation versus mobile site implementation, and also implementing wound care services alongside certain services programs, and really focusing on the implementation and first year operating costs of the program. So not cost effectiveness, but really focusing on cost analysis. So I'm going to pass it back to Brandon. We're just really excited to be here and to continue to be in the CHERISH web.
Thank you. Great. So I will move forward with our presentation. So I just want to give everybody a little bit of orientation and introduction to the center itself, and then we'll talk about pilot grants. So CHERISH stands for the Center for Health Economics of Treatment Interventions for Substance Use, HCV, and HIV. It is a NIDA-funded national center of excellence where they're focused on developing and disseminating health economics research and healthcare utilization, health outcomes, and health-related behaviors, informing treatment for HCV, HIV, and substance use and their overlaps between these diseases. Just for everybody's orientation to the center is really a service-focused center. So we do many of our members do research, but we also provide services to external people as well. One of those services is our CHERISH consultation service. This is a service that is run by Dr. Sean Murphy here at CHERISH. Just for everybody's information, this is a service that's available to anybody. So even if you're not a pilot grantee, if you have any interest, you can go to our website and you can request a consultation through our center. And that is a free 6-hour sort of consultation service that they will link you to a person who's an expert in whatever your question may be. If you are a pilot grantee, if you are awarded one of our pilot grants, you will meet with Dr. Sean Murphy during the initial phases of your pilot grant, and then he can help connect you to any of those services if you need them for the purposes of your pilot grant as well. In addition, the center provides various trainings. Some of these are in person. We also do have training modules that are hosted on our website that you're free to go to at any point and sort of take advantage of as a member of the community. And then we also occasionally do trainings that are developed specifically for other sites, so NIDA centers, P30 programs, and other PhD programs, etc., that we can set up through the center as well. And then we also do have a list of resources that are available on our website if you want to go to our website and find those other resources as well. Now, specifically for the pilot grant program, which is why you are all here, the pilot grant is a program every year. It's a 1-year program, 12 months. The funds are up to $20,000 for research in the area of health economics related to substance use, HCV, and HIV. This year, we will be funding 3 pilot grants that are at any institution in the country. And then we also will be funding 2 that are internal to Weill Cornell that our institution is funding, but the other 3 are funded by NIH directly. So eligibility. So as Maggie and Tyler both mentioned, you can be fairly early in your career and still be eligible for the pilot grants, just so you know. So some of our pilot grantees have previously been CHERISH researchers, so they're members of CHERISH already. One of our investigators or affiliates. But we also primarily like to fund early career investigators, so postdoctoral fellows, doctoral students, early trainees if you're medical doctors, fellows, or residents as well. But our focus is primarily on this population. But any investigators are eligible to apply as well. And we just connect you to a CHERISH mentor or researcher. It's sort of a sponsor for the program as well. And as Maggie and Tyler already mentioned, so I want to ask them this again, where they were in their careers when they applied for their pilot grants. They were both pretty early in their careers. So a little outline of sort of the timeline for the application process overall. The letters of intent are due in January 12th of 2024. These are non-binding, so if you submit an LOI, it doesn't mean you have to submit an application. Then the actual proposals are due at the end of February 23rd, and then we will do our reviews between March and April, with the funds awarded at the beginning of May in 2024. And as I mentioned, it is a 12-month grant cycle, so the funds are for 12 months. Although people often request extensions, but in general, it's a 12-month timeline. For the letter of intent, the information that we generally ask for are fairly a little bit of career stage information, demographics information, and then a project sort of overview. This is usually pretty short, a couple paragraphs, 600 words or less. That's just information that we utilize to help us line up reviewers for your application when you submit your application, but it also helps us give you feedback about making sure that the application fits with CHERISH's goals, as well as the NIH priorities for health economics and HIV. This year, we will have some special topics, which I think is on the next slide. Oh, no, a couple slides. So this year, we do have a couple special topics we'll talk about a little bit later as well that we're sending out the application for. And then the proposal submission is due February 23rd in 2024. So the application follows NIH application structures. So you have the research plan, budget, and support, and then there's a section that is unique to us, which is relevant to our pilot grant program specifically. So what your application, what your grant, your career plan is. So if you're early in your career, how the pilot grant might fit within your career goals. How your pilot grant fits with CHERISH mission, and then how it fits with NIH priorities. The overall application is about 4 pages for the science, and then just the additional documents for budget and support and relevance. But it's a relatively short application. This year, we do have 2 special topics of interest. So the first one is the U.S. Department of Health and Human Services 2030 goals for HCV and HIV, addressing those epidemics. So the HCV goals is the elimination of HCV infections by 2030, HIV goals of ending HIV epidemics, specifically targeting new cases and reducing new infections to 0 by 2030, which is their goals. The second special topic for this cycle is social determinants of health as defined by the U.S. Department of Health and Human Services. So we're looking at social things that affect your outcomes, so where people were born, live, learn, work, play, worship, etc., that may affect their health outcomes as well. That being said, while these are special topics of interest this year, your applications do not have to fit with either of these special topics, as long as they fit with substance use, HIV, or Hep C in general. You're still eligible to apply. All right. And then for the proposal review, this is sort of also modeled up to NIH grant application proposals. So there are 5 areas that we review the proposals. So significance, investigators, innovation, approach, and environment. And then they're scored on a scale of 1 to 9. This is similar to NIH processes as well. And then get an overall score. This proposal reviews will take place in March and April, as I mentioned earlier. And then we will do a ranking like the NIH does and sort of decide which projects will get funded. How do awardees spend their budget? This is a question that many people ask when they're applying for pilot grants. So you can use this for data acquisition, time and effort. This is your own time as a PIs. It can also be for analysts if you need data analysts to help you with your projects. For publication fees, conferences, travel fees, participant incentives, and transcription or translation services as well. So it's a pretty broad range. If you do have specific questions about how you're thinking about spending your money, please feel free to reach out to us and ask. That being said, at this point, I'm going to take a quick pause or break and just ask Maggie and Tyler to tell us a little bit how they spent their pilot grants funding.
Do you want me to go? Or Tyler, you want to go first this time?
Sure, I guess I could go first. I actually had to pull out my budget because it's been so long since I had this grant, so I had to think about what I spent my money on. But the funding from this grant really focused on supporting my time as a PhD student. So it covered like half of my student stipend for my second year, so I can dedicate to this project specifically. But it also included funding for conference travel and also workshops. So I more trained during my PhD in prevention and implementation science, and really wanted to learn more about health economics, economic costing, all of the above. And so I was able to leverage this grant to travel and go to workshops on cost analysis and cost accounting, things that I was not going to receive during my doctoral training. I was able to leverage in my grant and my budget to provide funding to go to workshops for that.
Cool. Yeah, so mine was a little bit different. I think I also looked at my budget, and most of my money was spent on actually research assistant time. I think I had a fair bit of like primary data collection that was done. So paying for like an RA for the summer and some additional RA time for, kind of like doing the analysis of the transcripts and things, as well as just doing the survey, like data collection. And then I also spent some money on participant incentives and then traveling to conference to like present the work. So sort of slightly different, but I think all good examples of how these funds can be used.
Great, thank you. Just for everybody's awareness, you can use the pilot grants in conjunction for if you're on a K award. So some people may have K awards, and that question does come up as well. So if you have a K award, you are eligible to apply for this pilot grant as well. The funding just has to be used for something in it separate from the K specifically, but it can use to enhance your K award potentially. That is a question that often comes up. Next, we're going to talk a little bit about sort of the pilot grant support. So these are the services that you get as a pilot grantee. The first one we talk about is communications. So we have a pretty good communications team here. Bonnie is sort of our guru for communications for the CHERISH Center. So I'm going to actually pass it off to her to let her talk a little bit about the communications support for the pilot grantees.
Hi, everyone. Nice to join you here today. So my role is the communications manager and CHERISH. And big picture, I help amplify CHERISH work, including CHERISH pilot grantees. And so my role within the pilot grantees journey is to also share their publications, introduce them to our followers and audience, and get the work out there. So oftentimes, once our grantees have been announced, I would collaborate with the grantees to draft the introductory article, kind of like a bio introducing their academic and research background. And along the way, whether it's after the completion of the pilot grant year or 2 to 3 years from that point, our team does stay in touch through email, social media, to see if any of the pilot grant work is in the pipeline for publication. And I'll just drop 2 examples of pilot grants that have been published. And it's just a good example of a little bit of the work that I do here at CHERISH, and also some of the amazing projects that pilot grantees in general have contributed. So while I get the links, drop the links in the chat, I'll pass it back to Brendan.
Thank you. So as Bonnie mentioned, we do provide a lot of support, sort of communication and getting publication around your pilot grants. That is something that CHERISH provides. In addition to that, we have dissemination training. So one of our partner institutions is the Leonard David Institute, which is at Penn State. Dr. Zachary Mizell, sort of the director there. So during your pilot grants, early in your training, you will get, early in the pilot grant, you will get training through the Leonard David Institute, developing your dissemination plan specific to this pilot project, but also just giving you some training about how to disseminate and get your pilot grant and all grants as you do research going forward out there, so that you're sort of impacting the people you want to impact with pilot grants. So whether that's policymakers, other researchers, et cetera, but they'll sort of help you develop those strategies and develop your skills around that. In addition, we have career mentorship. So during the pilot grant, you will meet with myself and Jared quarterly. And in addition, you will meet with Dr. Bruce Shackman, who is the center director, twice a year. The focus of those meetings really is to talk to you about your career goals and sort of help you think about ways to progress in your career. So depending where you are, if you're early in your career, making you connections to other institutions, if you're sort of going on the job market, if you're a postdoc or early, or if you're a doctoral student, linking you to places where you could look at postdoc training, but sort of connecting you to institutions you might be interested in jobs as well. In addition, we do have sort of open office hours. So if you have questions during the course of the pilot grant for us, or if you're having issues where you're running into roadblocks and need some more help, we can help with that as well. And then, as I mentioned earlier, our consultation service, which is run by Sean Murphy, you do have access to that as a pilot grantee, and he can connect you to people who are experts who may be able to help you if you're having sort of methodological issues while you're doing your pilot grant and you need additional sort of help or support as you progress during your analysis particular. All right. Some of the outcomes that we do track for the pilot grants are what we call hard outcomes. So these are things we report to NIH directly. So these are manuscripts, conference presentations, or subsequent grants that are a result of your pilot grant. And then there's some sort of soft outcomes that we are interested in, which is skill development, any collaborations or networks that develop as a result of your pilot grant, and then connections to mentors, either for you becoming getting mentorship, but also many of our pilot grantees go on to become mentors for other people in the course of CHERISH's, so additional pilot grants subsequent years as well. At this point, I am going to ask Tyler and Maggie to tell us a little bit about what came out of their pilot grants, particularly for hard outcomes or manuscripts, conferences, presentation, but any skills or anything else that they thought they learned through their pilot grants.
Sounds good. Do you want me to go first this time?
Sure, go ahead.
All right. So yeah, so I feel like I had some mixed hard outcomes. I had one manuscript that came out of some qualitative work that I did, kind of talking to public librarians about their experiences kind of addressing overdose and substance use and in their libraries. I say mixed because the survey that I worked on was a little bit of a COVID casualty because libraries were not really as accessible during that time. And I think that's just the reality of research where that kind of got delayed, and we did end up collecting the data, but I haven't published it yet. But I did present the first part at a conference. And I think, this, like, just the experience of sort of writing the grant and has got then, and some of the data has gone into future grants, either that I've worked on myself or collaborated on. And some of, I still do some work, like my team still does like harm reduction outreach and trainings in public libraries and some other things that I think have kind of come out of that grant. I think the soft outcomes are probably also important to talk about. I can just say briefly, I mean, the collaboration and networking was great. And I actually have since become kind of an official member of CHERISH. I work kind of with Zach Meisel to co-direct the dissemination and policy course. So that certainly was a big piece for me as well. So yeah, I think outcomes on both sides.
Yeah, my outcomes are very similar to Maggie's outcomes as well. I was able to publish my pilot grant in a journal, harm reduction journal, a few years ago. It also was part of my dissertation. So it was one of the aims of my dissertation. So I was working on dissertation 3 months into my PhD. So I was a little bit ahead of the game when it came to that. But so I was able to get a dissertation and a PhD out of part of, being funded under this mechanism as well. And as far as, grants go at this point in time, what I've learned through the pilot grant process, through the mentorship, through the collaboration, through the skill set that I was developing has really assisted in developing really impactful grants moving forward. I think I'm now on the verge of having my second R1 being funded. I got a fundable score recently, so fingers crossed that it moves forward and gets funded very early on in my career as assistant professor. And I think a lot of it is attributable to this. I work with Josh Barokis, who was a CHERISH affiliate and involved in CHERISH in the modeling unit. He's on my other R1 doing the cost and cost effectiveness, and allowed me to have the skill set and the language to talk about health economics and cost and what we should be collecting. And it really was supportive in grant development and in my career moving forward. So just, the intangible things I think are really important that this grant provides.
Great. Thank you both very much. And then just a little bit for the post-grant cycle, just for everybody's sort of awareness. So the pilot grant, as I mentioned, is a 1-year grant itself. That being said, many of our pilot grantees have gone on to do other work with CHERISH. So we do have a mentee program that some of our pilot grantees have joined after that, which is sort of an ongoing monthly meeting for a year, providing a mentorship for pilot grantees and primarily with career development specifically. There is also research affiliate programs, so people can link to CHERISH and join our affiliates program. And then, as I mentioned earlier, many of our pilot grantees have gone on to be mentors for pilot grantees in subsequent cycles as well. All right, so that's sort of the end of my presentation. We are going to open it up to questions for everyone. If you have questions for me, or if you have questions for either Dr. Lowenstein or Dr. Bartholomew, or for pilot grantees, so we will open up to questions. Seeing none, I am going to ask a couple. So for Tyler and Maggie, if you both could tell me what you thought was sort of the most valuable part of the pilot grant for you. You mentioned a little bit about sort of soft outcomes that have happened, collaboration specifically, but what do you think was the most valuable part of the pilot grant program for each of you?
Yeah, I think the most valuable piece of this puzzle for me, especially, the stage that I was at, really ambitious on what I wanted to do and what I wanted to accomplish. CHERISH was able to kind of foster this environment of connecting me with individuals who have done this work for decades. I was able to be mentored by multiple different people in this space. And so to me, like the network that what's been created from just being a CHERISH pilot grantee has been incredible. CHERISH Center as a whole has just opened up so many opportunities, in this space for me as a researcher. And so to me, I think that's the most valuable thing is just, the mentorship, the support, the connection and the networking that comes from this type of grant has been the most impactful for me.
Yeah, I'm gonna sound very similar. I would say I think the project was good and I learned a lot from it, but I think similar to Tyler, just the collaborations, the networking, the kind of future opportunities, just getting a little bit more immersed in this space. I recently submitted an R01 where I included kind of cost and economic analysis, which is not something I would have necessarily thought I would be doing back 5 years ago, but I think it really complemented the work, and the exposure to kind of the CHERISH network and collaborators has been helpful. So yeah, I think a lot of the soft outcomes or the intangibles are, I think, a big part of it. You're sort of part of the family, the communication support, the network, et cetera, is really valuable.
Great, thank you. So I do see a few raised hands. Marlene Lira, I'll call on you first.
Great, thank you so much. And I'm so appreciative for this presentation as well. So thank you for all of the information that you've been providing. My question, so kind of to set the table, I work at a startup that provides telemedicine for substance use disorders, and I'm not at an academic institution. I'm also a doctoral student in health policy. And in addition to that, I'm currently engaging in the CHERISH consultation service with one of your experts. And I'm wondering, am I eligible as a person who's not at an academic institution to apply for one of these pilot grants?
That is actually a good question. I believe so. We'd have to figure out how the contracting would work exactly. Jared, I don't know if we have an answer on that because we have not actually funded somebody outside of an academic institution previously.
Yeah, we're gonna have to we'll have to get back to you on this. Obviously, if there's a possibility of routing it through the academic institution where you're getting your PhD, that would, that I'm clear would work. But well, I'll follow up with you by email afterwards, and I can learn a little bit more about the organization where you work, and we can do some investigating and find out what the eligibility requirements may be.
Thank you so much. I think it could probably work through my my graduate institution. So it sounds like that, yeah, either of those. Thank you so much.
Yeah, no problem.
Thank you. I'm gonna butcher your name,
Aditi.
I think.
Yes, thank you, Brandon. My name is Aditi. I am a pharmacist and health services researcher, and I'm a postdoc at Yale School of Medicine. And I came across this opportunity from my PI, and I have not done health economics research, and I know it's a pilot grant, so I don't know like KL2 mechanisms that allow for someone to say, well, I will take classes in this, or I will collaborate if there is room for that, because there are very few opportunities for like early career researchers in HIV and substance use. So I was very interested in this, but I know that I do not have like the health economic background, although like pharmacy have a lot of payback models and so on, but I've never really explored that in depth. So I guess my question is, if the grant allows for opportunities for researchers to fully explore and develop themselves through the grant in health economics research.
Yes. So generally the way it would work is if you don't have the specific experience yourself, we would try to make sure that within your sort of mentorship team, that there's somebody who could sort of help develop that. It's a relatively small grant, so there's probably not a ton of money for you to like pay for coursework and that sort of thing, if that's what you were thinking. But if you're sort of thinking, have a project in your mind and you want to add some economics or develop that skills, the way we would do that is just make sure your mentorship team, either one you already have at Yale or we have connections at Yale, connecting you people there who could sort of help you develop that skill set, or connecting you to somebody within the CHERISH network who could sort of help you develop those skill sets. If that's the case, we should probably connect earlier rather than sooner. Just sort of think about your project and how we could help you develop that when you're creating your pilot grant application itself.
So that takes me to my next question. Who shall I reach out to, or should I reach out to the Cherish general email?
So you can email us directly. So you can do on the website, there should be a pilot grants email. You can email that, the pilot grants email.
Thank you.
Goes to one of us.
Thank you.
Sure, no problem. I thought I saw another hand and it disappeared.
Yeah, I had another question. So, hi, I'm Miranda. I'm an addiction psychiatrist and implementation researcher. So, I had a question about, you said sometimes the funds have been used for classes, but it's not a ton of money, and classes can be pretty expensive. So, through the program, are there courses along the way that you can jump in on? Because I know Cornell, sometimes they have the biostats class. They've had things like that in the past that don't necessarily require tuition.
Correct. So are you at Cornell, the institution? Or you're...
No, I train at Cornell in residency though, so I know Bruce and Sean.
Okay. Yeah, so Cherish itself has some courses that we do some trainings. And then there's the trainings that are on our website. They're relatively short trainings. So depending on what your needs were, we'd sort of have to figure that out if those would actually work for you. But my guess is if you're sort of don't have, it sounds like you have some background in health implementation science already. But if there's some specific skill you were looking at, we'd have to see if one of those trainings would work for you or connect you to training that might work for you, or make sure we develop your team for the research project so that somebody on the team can help you develop those skills. And that may be somebody within your institution, as I mentioned, or maybe somebody in the Cherish network that we would connect you with to do that.
Okay, that's helpful. And then the other question I had, you might have mentioned this earlier. Sorry, I'm in the clinic today, so I may have missed it. But if you get funded and then you were to get a K-23 or an R01, how does that overlap with the funding? Can you continue to receive the pilot grant funds, or does it conflict?
You can. So generally, the pilot grant is NIH funding. So any funding you get from NIH just can't be used for the same purposes. So as long as your pilot grant is paying for something different, it may be related to your primary award, but as long as it's funding something else it's different, then it's usually fine. So it could be used to, like if you're planning on submitting a K award or an R01, and that's for a bigger project typically, obviously, this may be helping to supplement. You want to do some additional economic evaluation alongside that bigger grant, or you want to do something alongside that bigger grant. That's typically how this award is used for alongside those. But yeah, they can't be paying for the exact same thing. So I wouldn't submit a pilot grant and a K grant with the same exact names, but as long as
got it.
Yeah.
Okay, thank you so much. I'll follow up in email with some other questions. Thanks.
Sure. Raquel Fetzer?
Yes, it's me. Good afternoon. Thank you so much for this information. So I work at the Department of Behavioral Health and Intellectual Disability Services for the city of Philadelphia. So we have a SDOH equity unit that is on my team. So I had shared this information with my SDOH equity unit manager, and she had a question. So she wanted to see if this funding would be able to be used to fund any resources, or is it specifically just for research, or could it be used for someone to do research on our existing resources to prove that they are working and helping folks, and then be able to help out with them continuing to be funded?
So it is for research funding. So if you have like a program, it can't really be used for programmatic sort of funding itself to carry out a program. So if you're delivering some sort of services, etc., it wouldn't necessarily be used for that, but it could be used to evaluate a program that you already have ongoing and sort of use that information then subsequently to continue getting funding, or to go to policymakers to say, hey, this program's working, please continue. Okay. Yeah.
Perfect. That's very helpful to know. Thank you.
Sure, no problem.
And Raquel, I'll just add one thing. So definitely program design and evaluation where, you know, we funded previous awardees with that kind of methodology. And then the only other caveat is that it needs to include a health economic component. So it's got to have some type of healthcare utilization or something related to costs. And that's something that if it's not apparent in your application is something that is usually will put you at the bottom of the pile. So that's something to, as you know, as you put together an idea, reach out to us because we can talk to you a bit about whether it seems like we're aligning in that area or not.
That
And
would,
yeah, and that also is a requirement from our funder where they really want us to focus on their purview or their definition of health economics. So yeah, feel free to reach out. We're happy to chat that through.
wonderful. Thank you so much.
Yeah, I mean, just as general information, anybody that we really do use the LOI to sort of make sure that people are applications sort of fit within Cherish, and we'll give you feedback after that. But if you have questions as you're thinking about your LOI or pilot grants before that, please feel free to reach out to any of us to the email at any point and send us any of those questions. Or if we want to set up a time to actually talk one-on-one, sort of thinking through your projects, we can do that as well.
Raquel, I was just going to add as another Philly person, you may have, you guys, I know your department works a lot with the Center for Mental Health at Penn, and like David Mandel, he's my K mentor. And I think if you want to sort of think about projects, I think we could all talk as well. So in addition to what these guys are offering, should chat.
Yes, that would be wonderful. And Laura did actually mention that this would be a great project to do with Penn students as well, to take advantage of this opportunity and like do some evaluation.
Sounds good.
Thank you. Can you do me a favor? Could you drop your email address in the chat? Thank you.
This is Marlena Lira again. I had another question, which I'm not sure you can speak to, but if you can, I'd love to kind of hear your input. I'm curious about how many applications you tend to get and how competitive it is to have one of these awarded.
So in general, applications, they vary somewhat from year to year, but on average, I think we probably get around 10 to 15 applications. So roughly funding is anywhere from a third to a half of the actual application. So it's relative to normal NIH funding mechanisms. It's not as competitive. It's easier to get funding through the pilot grant. So it's a little bit easier from that mechanism, but it's roughly, I would say, about a third to half our applicants actually get funded. And part of that is, as I said, we really do try to work with pilot grantees to make sure your application is as strong as possible. Some of that can happen before the LOI, some of that happens between the LOI and the actual application submission. So if you submit the your LOI and we're like, this project isn't quite fit what we needed to do, a lot of times we'll reach back out to those people and sort of work with them to make sure that their actual pilot grant is really fits and is as strong as possible.
Great, thank you so much.
Sure. If there are no other questions, I was going to I had one more question for Maggie and Tyler. When you were doing your application, is there anything that you wish you knew as you were doing the actual application, or are you thinking about during the application process that would have been helpful to know ahead of time?
Man, you're really stretching my memory here, Brandon. You're really stretching the memory. I don't know, Maggie, what's the start on this one?
I'm feeling similar. I mean, I think like the format very much mirrors, as Brandon said, mirrors like NIH applications. But at the time that I did this, I had never done an NIH application. So I think just in that sense, it's like a good practice run for those of us for going on to apply to future grants. But I remember just, you know, leave time, because some of it you need a little hand holding for if you haven't done an application like this. And I guess, you know, I also incorporated some newer methods. So I ended up kind of needing to talk to different mentors. And I think, you know, maybe was a little rushed at the end. So just, I think building in some time to do that is important. I'm going to try to think of something more helpful, but maybe Tyler's thought of a good tip in the meantime.
No, I think start early and reach out early. I mean, the fact that you're here listening and in this listening session to hear what the grant entails and the application process and things like that. I don't even think I'd sat in a meeting like this to even become oriented to what was required for the pilot grant application. So the fact that you all are here, you're already taking the initiative to really understand the process. So kudos to you all. You were ahead of me at this time.
Okay.
Submitting my pilot grant as well. So I would say leverage those resources, really reach out to Brandon and Jared, and they're so supportive and would sit down one-on-one to discuss your application with you.
All right. Great.
Thanks.
Does anybody else have any? Oh, yeah, go ahead.
I was just on the application page and it looks like there's a link to a spreadsheet for the budget, but that is not currently working.
Ooh.
It should be updated before the actual application deadline. It's the same.
Okay.
It's the same budget spreadsheet that the NIH uses. We just update the most recent one when it gets closer to the actual.
Okay, perfect. I just want to make sure I let my grants office know because they like to be told nice and early about these kind of things.
Yeah, the budget spreadsheet is literally lifted straight from the NIH. We use the exact same one that they do. We just make sure we have the most updated one loaded.
That's a good reminder too. I think that you need to go through your grants office. That was something I also had never done before. So I think if you haven't done it, just figuring out who that person is and kind of how to work with them. Again, it's like good practice, but not something I had done at the time that I applied.
Bree, thanks so much for flagging. When I send around the eval after this, I'll make sure to include the template that we have so folks can take a reference at it before we get it uploaded to the website.
Awesome, thank you.
And speaking of evaluation, I'm just going to throw that link in the chat as we greatly appreciate any and all feedback from folks, and particularly on what was useful and or what would be useful if we were, when we do this again next year.
All right. If there are any other questions, there are a few FAQs that frequently get asked. I'm just going to throw this out there for people in case they have information. For purposes of applications, alcohol use disorder is considered substance use disorder for us, so you can submit that as well if that's part of your broad range of substance use disorders. The grants are generally for individuals, so there's a PI that needs to be associated with that, and then generally they do go to academic institutions. Non-US citizens are eligible to apply as long as they're based at a US program. We do not currently fund for foreign institutions. So if you're not based at a US institution, unfortunately at this point, we can't fund those projects. But your project can be international, just so you know. So as long as the institution is US based, your project itself can have an international global focus. All right. There are no further questions. We will end there. As I mentioned, please feel free to reach out to us at any point if you have questions going forward or would like to discuss your sort of potential pilot grant as well.
Special thanks to Maggie and Tyler for joining us and sharing. Really appreciate it.